Hi, everybody. Welcome to our webinar this evening. I don't want to keep you any longer than necessary, but wanted to welcome you here and thank you for logging in to listen to some information about our Bachelor of Science in Health Information Management degree. So thanks again for joining us tonight. So this is me, Ellen Carl. I am the Academic Director of the Health Information Management Program at the CUNY School of Professional Studies. So I have many, many years of working in health information management. I started out my career as a traditional undergraduate, having graduated from the University of Central Florida with that BS in Health Information Management. Actually, at the time, it was called a BS in Medical Record Administration. But we made the change over. And I also have an MBA with a concentration in health administration from the University of Miami. I'm really not a Floridian. I'm really a New Yorker. I do live in New Jersey, so I guess I consider myself to be a metropolitan New York person. But a little bit more about me. I'm a really active member and volunteer with AHIMA, which is our professional association. I'm pleased to let you know that I'm finishing up the third year of a 3-year term on the National Board of Directors for AHIMA, which has really been a phenomenal experience for me to volunteer at that level. I have volunteered at the state level, the local level, et cetera, mainly in New Jersey, but also a little bit in Florida and New York. Most of my career has been spent as a health information management, like department director in acute care hospitals, in your traditional hospital setting. Worked in Florida, in hospitals in Florida, New York, and New Jersey. So I've sort of been, had different experiences in different acute care hospitals. So that's a little bit about me. I'm going to now turn things over to my colleague, Janet Molenhoff, and she's going to introduce herself and then begin the presentation.
Hi, everyone. I also have over 25 years experience working in the field of health information management. I have a bachelor's degree in health information management, and I have a master's in public administration with a concentration in healthcare from Alfred University. I've also worked in a hospital setting, but I've worked in other types of settings as well. I've worked in a long-term care setting and also a clinic for the developmentally disabled. So there's a lot of different healthcare settings that you can work in with this degree, as we'll soon see. I also am an active member in the AHIMA Association, as well as my state and local associations, and I am a New Yorker, as you can tell by my accent. So I guess we're going to go to the next slide. And what is really health information management? Sometimes this is a very tricky thing to describe to people. I guess the official definition is this: it's the practice of acquiring, analyzing, and protecting digital and traditional medical information vital to providing quality patient care. So it's a little, not many people understand what it is we actually do. We really work with healthcare providers and the clinicians. We also have a big role with the IT department. We sort of sit in between and help both of those sides of the area. So next slide, please. As you can see, these are some of the areas that you would study in HIM. Information governance. Information is out there so much now, and we really need to keep track of it. There's so many different computer systems that an organization utilizes, and we need to know how that information is protected, where it's stored, and just the overall governance of that information, and that's really a huge role of health information management professional. We also need to know informatics. We need to know that analytics, because as I mentioned, there's so much data out there now. We need to understand how that data can be used. What analysis can be performed on that data to help to improve that healthcare. Revenue cycle is also a huge portion of our work, and this is something that students definitely need to know and understand. And since there's so much regulation in healthcare, students really need to understand how to comply with all these different regulations. So that's also a huge area that you'll study in the program. And of course, leadership. You know, the health information professional is really a leader in that organization. Next slide, please. So this degree that we're talking about today really leads you to be eligible to sit for that RHIA credential exam. That's the Registered Health Information Administrator's exam. We are CAHIM accredited program, and that's what, because we are a CAHIM accredited program, that is what allows you to sit for that RHIA. There's many different competencies that we must show that we provide to students in the program, and that's how we become accredited. And this credential, the RHIA, is a very sought after credential in the healthcare industry. If you go to any number of the different websites that job websites and just plug in RHIA, you'll see all different sorts of positions that that is one of the requirements. Next slide, please. So what does this RHIA really do? As I mentioned before, we really work with the providers. We also work with the payers. We also work with the patients. Right now, there's a lot of, the big thing in healthcare is patient portals, where the patients can actually access the information themselves, their health care information themselves. We can help facilitate that, so that that the patient needs access to their medical records so that they can bring it to another physician for another consultation or whatever, that we help facilitate that. So we really, on a day-to-day basis, manage that health information, or those medical records is sort of an older term, and we interact with many different computer information systems, because, you know, there is that electronic health records, but there's also a lot of different information systems that connect to that electronic health record. And again, we collect and analyze some of that patient data. And with the electronic health record, there's really a lot of data out there right now, and we don't really fully use all of that data right now. And we also use different classification or coding systems and medical terminology. We really need a strong foundation. We need the ability to speak with those healthcare providers. We need to speak their language. So we have to understand anatomy and physiology. We have to understand the disease process and that sort of thing. So we also need to know the administrative side of healthcare. As I mentioned before, there's a lot of regulatory things. So with healthcare, so we need to know the legal and ethical requirements, and just in general, how healthcare is delivered in the healthcare setting across all different sorts of delivery systems. As I mentioned, a hospital and long-term care, in a clinic, wherever healthcare is delivered. And we need to really act as an advocate for the patient to protect their data. I think now in this day and age, a lot of people are aware of privacy concerns, because there's so much information out there. So we really need to ensure that that data of those patients are really protected. Typically, an RHIA also oversees operational units. They'll have employees that they oversee, and we also sit on various administrative committees within an organization, and we typically would prepare a budget for that area, whatever that would look like. It could be for the department or just one area within the department. So as I mentioned before, there's a lot of different career opportunities for graduates in HIM. We have, these are just a few titles that you might find when you sort of look for that RHIA credential and what positions are out there. Health information manager is sort of that generic term for a health information professional. There's many different duties that you might be doing. You might, again, specialize in one area or oversee the entire, several different areas within a department. A clinical data analyst, as I mentioned before, it's really all about the data out there. There's so much data and it really needs to be analyzed. Implementation support specialist, again, with that implementation of electronic health records, many organizations are now transitioning to a different electronic health record. So there's definitely room for an HIM professional to help implement a new electronic health record. DRG validator, they work really with the in the coding area and sort of make sure that the records are correctly coded so that the facility gets the correct reimbursement. And they're very specialized. The revenue cycle auditor, they see the whole revenue cycle, not just that the bill is going out the door. They're looking at the whole process and making sure that it's a smooth process, because it's very important that a healthcare organization be reimbursed properly for the services that they have provided. If you take a look at the bottom of the page there, that hicareers.com, there's many more different titles that are listed on there. There's a career map that might help you out to see what the different other different titles that are out there. So I've spoken a little bit general about the field of health information, and I'm going to now kick it over back to Ellen, and she's going to tell you more about the actual program here at SPS.
Thank you, Janet. Really appreciate that. So let's go into, as she mentioned, what exactly the program is and what the requirements are, et cetera. So this is a Bachelor of Science in Health Information Management. To be admitted to this program, really there are 3 different criteria. You need to have 24 transferable academic credits from another college. We don't really care what those credits are in. It could be 24 credits in any discipline. It does not have to be related to health information management. So you just need to have 24 college credits. Secondly, you need to have a GPA, a total GPA of 2.5 on a 4.0 scale. What that means is if you've been to multiple colleges in the past, we would like to see, when we total up all of your GPA from all of your colleges that you've attended, we would like to see a 2.5 GPA or above on a 4.0 scale. So one of the requirements is that you do need to submit also all of your original transcripts from any institution that you've attended so that we can review it and calculate that GPA. You also need to have reading and writing, and math proficiency. So usually the way students meet this requirement, being that we are considered to be a degree completer college, is that you would typically have taken a, English Composition 101 someplace else, and or a college level math class, whatever that might be. And if you have done so, that has met you have met the proficiency for reading, writing, and for math. If you haven't, perhaps you had some scores on some admission testing at a community college and whatnot, and those we can also use to determine your proficiencies in those areas. So in New York State, in most places, it requires that you earn 120 credits, academic credits, for your degree. So for this HIM degree, we have 39 credits in the general education curriculum, and many of these are required, and I'm sure you have had this at other colleges that you've attended. You have a bucket of social sciences, or you have a bucket of arts and sciences that you have to fulfill a certain number of credits in certain different disciplines. So that's what we also have the same thing. There are 39 credits in that gen ed curriculum, but they're divided up into different buckets. We have many credits in our major. We do have 75 credits in the major of HIM. We have many academic competencies that we need to meet in order to be a CAHIM accredited HIM program. So we know that we're kind of heavy in the major requirements area, 75 credits. And then there's 6 credits of free electives, which you can just pick any any course you would like. Many students meet that 6 free electives by some transfer credits. As far as HIM student resources are concerned, as Janet mentioned, HIMcareers.com is a great reference for you. If you're really unsure about what the HIM profession is about, that's a great place to start. It is, as she mentioned, there's a career map there. You can click on some of the items in the career map. It'll tell you what this particular job is and what the academic requirements are for that particular job. It might even give you job and salary history for that type of job. So I would use hicareers.com. Also, HEMA.org, the American Health Information Management Association is our we call it the mothership. We adhere to their principles and we're certainly gearing all of our students to be future members of HEMA with the RHIA credential. So they do have a career and student center on that homepage, and as we mentioned, the career map. We also have a brochure here at this particular website that's here on the screen. This was a brochure that was put out by the New York Allied Health Organization called NIACH, talking about careers in health information management. So I want to talk to you a little bit now about what it's like to be an online student. Some of you might already have an idea. Some of you may have attended schools where you perhaps used online program or online courses, took online courses. But I just want to go over a little bit because some of you may not. Some of you may have attended college a while ago, and this is all kind of new to you. What we really think is important and what it takes to be an online student, a successful online student, let's put it that way, is you really need to be cognizant and make time management very, very important in what you're doing. And that kind of goes along with discipline. We do suggest to students that you think about approaching your coursework, since you don't have to be anywhere at any particular time of the day or in the evening, like your traditional classes. You have to be someplace at a certain time in order to attend class. Well, you don't have to do that when you're an online student at CUNY SPS. So it's really important to manage your time so that you make sure that you adequately allocate your time so that you'll be able to accomplish all of the work required. We think it's important to even schedule yourself on your calendar. Give yourself an appointment and stick to it. Like if you think you're going to study on Wednesday night at 8 p.m. to 10 p.m., like you're on the webinar right now, you knew to schedule this into your calendar. If you think you need to schedule time into your calendar on Wednesday night from 8 to 10, put it on your calendar. Make an appointment with yourself. Make sure that you schedule it so that you have adequate time to complete all of the work. We do say at CUNY School of Professional Studies that students should allot between 9 and 12 hours per week for each course you're taking. So if we average that to 10 hours a week per class. So if you take 2 classes, that's 20 hours per week. That's really a part-time job. But if for some reason you think you need to take 4 classes a semester, that's 40 hours a week that you need to allocate toward your coursework, which then is really, as you realize, a full-time job. So we do think the students that are most successful at being an online student are those who are able to figure out how to manage their time and be disciplined about it. We also know that our learning management system is called Blackboard. Some of you may be familiar with that. But we also have a detailed orientation. It usually starts 2 weeks before the beginning of the semester. And we think it's very, very important that students complete this online orientation prior to the beginning of the semester. It really helps orient you toward what it looks like. How do you submit an assignment? How do you post on the discussion board? What does a quiz look like? How do you go about submitting an essay, et cetera, et cetera. So there are lots of important things that we put into our Blackboard orientation, and we do the orientation each semester. So it is very important, we think, to be a successful online student. So a little bit about what a course actually looks like. And this screenshot, as you can see, is from the fall term of 2017, so 1 year ago. This is our Introduction to Health Information Management, our HIM 202 course. If you look here, when you log into the course, every time you log into the course, you might come to an announcements page. In this particular screenshot, you're not seeing any announcements, but this is where your professor might say, okay, don't forget, by the end of the week, you have to do this quiz, or, oh, oops, I forgot, this is important, you might want to read it, you might want to take care of this, or, hey, I saw this article in the newspaper this week, you might want to take a look at it. So this is where you might get announcements from your faculty member about what's going on in the course. If you look at the left-hand menu, and this is standard, pretty standard throughout all of the courses at SPS, if not at all of SPS, at least in the HIM courses. You have places where you would click on all of these items over here on the left, announcements, start here. That's the very first week. You start here and you see, okay, this is what my course is going to look like, and this is what I need to do. Your syllabus and course information, your weekly folders, which I'll describe again in a moment, and then we might have a discussion board, your discussion boards and your assignments, how to check your grades. And actually, we put in this course a link to the AHIMA website. And a little bit, if you clicked on that, your professor link, you would see information about who your faculty member is, how to contact them, what their background is, etc. So this is what it would look like when you first log into a course. And if you had clicked on weekly folders on that left-hand menu, this is what you might have come to. So this is what you need to do for whatever week this is. I think it's probably week 1. So you would need to read this chapter 2 in this Abdo Hack book. And we're going to talk about, here it gives you a little bit of a description about what's in chapter 2. In addition, the learning objectives for this particular module or week. And then what your reading is. So you need to read chapter 2, pages 39 to 55, review of the PowerPoint, and view the history of documentation documents. And then look, there's a discussion board you need to do. Really the difference between an in-person course and an online course is the discussion board. And you're an online course, if you're an in-person course, you can chat back and forth immediately with folks in your course who's sitting there in the classroom. Although, as you know, sometimes there are those people that are sleeping in the back of the room, kind of hiding and laying their head on the books. Well, guess what? You can't hide in an online course, but we really do expect people to correspond in the discussion board. And in this case, you have a scenario to talk about. And we usually, at least in all the HIM courses, we want students to post their initial thoughts about whatever the discussion board prompt is. And then we want you to comment on 2 of your classmates' posts. This is how you kind of get the discussion going. This mirrors the discussion that you might have had in a face-to-face classroom. And there are points associated with this. So most students find that this is how you really get those points. Don't miss any discussion boards because you might miss out on some of those points. So that's sort of a brief peek toward what an online course looks like. And as I said, most are set up in a very similar fashion. So I guess I want to talk a little bit about why you should choose CUNY, the CUNY School of Professional Studies for our Health Information Management degree. Well, CUNY SPS is part of the City University of New York. I'm hoping most of you are familiar with CUNY. CUNY is a very large educational institution in the city of New York. There's wonderful opportunities for personal growth, job mobility, and upgrading. The school, the entire college, or the School of Professional Studies is regionally accredited by Middle States Commission of Higher Ed. If you're looking around at other schools and other programs, I would recommend that you really stick with a regionally accredited institution. In this case, because we live in the Northeast, or because we live in the middle Atlantic states, we are accredited by Middle States Commission on Higher Ed. There are 5 regionally accrediting bodies in the United States, so depending on where you live and what school you're looking at, just make sure they're regionally accredited. Oftentimes, if they're not regionally accredited, you might not be earning academic credit that could be transferred to another institution, or that would be considered if you might want to go on for a master's degree. So it's really important that your institution is regionally accredited. CUNY School of Professional Studies has also been ranked 16th in the nation on U.S. News and World Report's list of online bachelor degree programs. So we're pretty pleased with that, and we're in the top 5% of all those ranked institutions. So who are our students? And we like to say that our students are people just like you. Most of our students, overwhelming majority, are working adults, some in career transition. Our students have families of their own. Our students need a degree that fits their schedule, and we do have people from all across the 50 states and from around the world. Our average age of our student body, I believe, is about 34. Most people are working full time. And so we know how important it is. Many of you have family responsibilities, career responsibilities, and really, you really need this degree to propel you into the next phase of your career. So we know this, and we really want to help you along to the next level. So who are our faculty in this particular case? In the top picture here, you see Janet, the blonde, who's laughing a lot, and I'm just standing nearby very seriously. But this is a picture of Janet myself. And down below, one of our adjunct faculty members. But all of the folks who teach in the HIM program are experienced healthcare professionals, many of whom, all of whom are teaching the HIM specific courses are HIM practitioners. The majority of them are working full-time already as an HIM practitioner, and they are teaching as an adjunct because they love teaching and giving back. And all of our faculty members have had to go through an online teaching, how to teach online course prior to starting teaching with us. Many of our faculty members have taught other places online. It's not unusual anymore. It's one of those things that if people really enjoy this, they seek out other opportunities to do so. So we're lucky to have a really great group of knowledgeable practitioners working in our HIM program. So a little bit about student services. We have a career services department that can help with resumes and jobs, etc. If you do matriculate into our program, students are assigned one academic advisor, and they are with them from the start to the finish of their program, which is really nice for the student and for the advisor in that in that case, because they do get to know one another. We do have tutoring both online and in person. We have a library. We're affiliated with the Baruch Library. Baruch is one of the other colleges in the CUNY system, and they're not too far away from us. So their library is available to us in person. We also have an online library system where you can contact somebody 24 hours a day, 7 days a week. It's sort of like a consortia of library folks, and you might not be getting somebody at the Baruch Library if it's 2 a.m. in the morning. You might be getting someone who's on call at another location, but they certainly will be able to help you with your question about the library. And we do have a help desk that can help you with any technical issues that you might be having. So here are some of the frequently asked questions that we have heard over the years. So can I really earn my degree online? Absolutely, positively, yes. You can certainly earn your whole degree online. The second question I addressed maybe twice actually. We've talked about it. Once I mentioned it, and once Janet mentioned it. So is our school accredited? So yes, the school is accredited by Middle States Commission on Higher Ed. But specifically, the Health Information Management Program is accredited by CAHIM, which is our accrediting body that allows our program or graduates of our program to sit for that RHIA credential. So again, if you're thinking about other HIM programs, just be sure that they are accredited by CAHIM, so that would give you the ability to sit for that RHIA exam. There is no other alternative to being able to sit for that exam except for graduating from a program that's accredited by CAHIM. So and this is the next question, is a very frequently asked question. How long will it take to get my degree? Well, my answer is pretty much always, it really depends on you. So as I mentioned earlier, you need to earn 120 credits in order to earn a bachelor's degree. Some of you might transfer in with 24 credits. Some of you might transfer in with 90 credits, which takes me to my next question. How many transfer credits can you transfer in? Anywhere between 24 and 90. So that's a big difference in terms of transfer credits. So I cannot give you a pat answer about how long it will take to get your degree. So if you came in with 24 credits, certainly it's going to take you longer to finish your degree than those who came in with 90 credits. The other determining factor is how many courses you can take a semester. Now, as I said, about 10 hours a week per course. You can't go crazy here if you're working full time and you have, job and family lives, et cetera. You can't really go crazy with the number of courses. We think students should start out a little slow, maybe take two courses, see how it goes. See if you can figure out that time management for yourself, and then perhaps jump up to 3 or 4 courses if you really need to get going with it. But again, that too affects how long it will take to get your degree. We do offer courses in the summer. We have a handful of courses that we offer in the HIM program. It's a great time in the summer to take some of those general education courses if you still have more of those buckets that you need to fulfill. And we do have a very short 3-week session in the winter for students who have already matriculated with us and have been with us at least one semester and been successful. So that's a really short 3-week semester, or 3-week course that you're earning 3 credits for, but it's basically your 15-week course shoved down into, compacted down into 3 weeks. So next and last question is about credit for life experience or prior learning. So the answer to this is yes. And there's different ways that you can earn credit for prior learning or life experience. Some of you out there may have already some credentials with AHIMA, such as the CCS, which is the Certified Coding Specialist, which is one of the gold standards in coding. We offer credits for that particular credential. If it's an active credential, you can earn up to 21 credits for that credential. There are other credentials that AHIMA offers that we also can grant credit for. You also can create a portfolio to demonstrate that you are proficient in a particular area. It's a little bit complicated to explain, but there's a lot of information on our website about it. They sometimes hold webinars to talk about prior learning and how you can earn credit and what it's like to develop your portfolio. So the short answer to this question is yes, and we think that we really work hard to do the best that we can for the working adult student. So for more information, here's my contact information, as well as the contact information for Lucas Fuentes, who is our Director of Admissions. And then oftentimes students have questions about financial aid. So here is the contact information for Felix in financial aid. Feel free to email any or all of us, or there is also this information at sps.cuny.edu if you have a question that doesn't fit into any of those categories, and we'll be sure to help you with any and all questions you might have, either prior to you applying or in order to start the application process. So again, here's all that contact information. All right, well, thanks again for joining us this evening. We really appreciate your attention and your time. Know that your time is valuable. And if you have any questions about the program, or if you'd like an unofficial transcript evaluation, please feel free to scan your transcript to me, and we'd be happy to take a look at it and get back to you and give you an idea as to where you might stand with transfer credits. So thank you again, everyone, and have a nice evening.